I want to talk about something that I believe is one of the most significant missed opportunities in women's health. And it starts with a statement that most of us have heard at some point in our lives. Dysmenorrhea is a warning, it's not normal. Painful periods are not a rite of passage. They are not something you simply endure, manage with ibuprofen, and move on from. They're your body communicating clearly, consistently, and with increasing urgency if left unaddressed that something in the terrain is out of balance. And here's what makes this so important. Dysmenorrhea is not just a quality of life issue. It is an early warning signal. When we dismiss it, when we normalize it, medicate it without investigating it, push through it year after year, we miss a window of intervention that, in my clinical experience, makes an enormous difference to long-term outcomes, including fertility. Hey everyone, welcome back to the channel. If you're new here, I'm Megan, and I help women navigate their fertility journey using traditional Chinese medicine and holistic health practices. Today, I want to show you what that warning is pointing to, why early intervention matters so profoundly, and how TCM and modern research are, in their own languages, describing exactly the same terrain. Let's start with the foundational logic, because once you understand this, the rest of the video will make complete sense. In TCM, a smooth cycle is the expression of smooth qi and blood. When qi and blood move freely, when there is no obstruction, no stagnation, no accumulation, menstruation is relatively comfortable. It flows freely, it clears efficiently, and it completes without drama. A smooth cycle equals smooth qi and blood. Pain is the signal that something is obstructed. When there is obstruction, there is pain. That is the fundamental equation. An obstruction, by definition, means disharmony. Something in the system is not moving as it should. Something is accumulating where it should be flowing. Something is held where it should be released. Now here's the piece that changes everything. Obstruction does not resolve itself. Left unaddressed, it deepens, it compounds. What began as pain and stagnation progresses over months, over years, into more complex structural and functional changes. This is not inevitable, but it is the natural trajectory of an unaddressed pattern. And this is why dysmenorrhea is a warning, not because it's dramatic, but because it's early. The body is speaking before the pattern has fully solidified. And that window of early communication is one of the most valuable clinical opportunities we have. Early intervention. What is at stake? Let me be concrete about what I mean when I say early intervention prevents downstream consequences, because this is not abstract. These are clinical realities I see in my practice regularly. Fibroids. Uterine fibroids in TCM are understood primarily as accumulation of phlegm and blood stasis, often in the context of qi stagnation and underlying deficiency. They don't appear overnight. They develop over time as stagnation deepens and accumulates into tangible masses. Women who have had years of painful clotted periods, years of dismissed dysmenorrhea, frequently present with fibroids by their mid to late 30s. The pattern was present long before the diagnosis. The dysmenorrhea was the early signal. If we had addressed the terrain when the signal first appeared, the trajectory could have been different. Endometriosis progression. We have spent 3 weeks in the series discussing endometriosis, and the connection to dysmenorrhea is direct. Endometriosis doesn't begin as stage 4 diagnosis, it progresses in the same terrain that creates the conditions for endometriosis to develop. Blood stasis, cold, liver constraint, damp phlegm is the terrain that dysmenorrhea is alerting us to. This is why I take painful periods seriously from the first cycle a patient describes them. Not because every woman with dysmenorrhea will develop endometriosis, but because the pattern that produces the pain is the same pattern that, left unaddressed, creates the structural changes we see in endometriosis. Infertility. The connection between dysmenorrhea and fertility is perhaps the most urgent and least discussed. Obstructed chi and blood, the root of dysmenorrhea, is directly antagonistic to the conditions that are required for conception. Implantation requires more. It requires adequate blood supply to the uterine lining. It requires smooth movement of chi to support the embryo's arrival and attachment. When a woman has been carrying blood stasis, cold, or liver chi constraint for years before she begins trying to conceive, she's not starting from a neutral baseline. She's starting from a compromised terrain, and the work of addressing that terrain, of rebuilding warmth, clearing stagnation, nourishing blood, it takes time. This is why I say again and again, early intervention changes long-term outcomes. The best time to address dysmenorrhea is not when you're ready to conceive, it's years before. But the second best time is right now, wherever you are in your journey. The emotional layer, liver, stagnation, and silent endurance. I want to spend time here because this is the dimension of dysmenorrhea that is almost entirely absent from conventional medicine conversations, and it's clinically essential. In TCM, the liver is responsible for the smooth flow of chi throughout the entire body, and the liver is deeply, intimately connected to our emotional lives, specifically to the experience of constraint, holding, and suppression. When emotions are chronically suppressed, when a woman has learned to contain her feelings, to overfunction, to endure silently rather than express fully, that holding pattern becomes a physical pattern. Liver chi stagnates, and stagnant liver chi obstructs the smooth movement of blood. Over time, that obstruction manifests in the most liver-governed territory of the female body, and that's the menstrual cycle. Endometriosis is often not just a gynecological disorder, it's a pattern of containment, overfunctioning, silent endurance. I want to extend that statement beyond endometriosis because I see this pattern in dysmenorrhea broadly. The women who present with the most severe menstrual pain are very often the women who carry an enormous amount of professionally, relationally, emotionally, and who have learned to manage that load quietly, efficiently, and without complaint. They're the opposite of dramatic. They are the women who show up, push through, and minimize, and their bodies, in the most faithful and honest way possible, are communicating what their voices have not been permitted to say. Pain is communication, and when we address the emotional layer, when we create space for liver chi to move, for feelings to have somewhere to go, the physical pattern often shifts in ways that purely physical interventions cannot achieve alone. This isn't soft medicine, this is precision medicine. It takes the whole person seriously. Different language, same terrain. Now I want to do something I find deeply satisfying clinically, and I think will land powerfully for those of you who are navigating both conventional medicine and TCM simultaneously. I want to show you that modern research and TCM are describing the same thing. They're using entirely different language, but they're looking at the same terrain. Different language, same patterns. What modern research tells us about dysmenorrhea and endometriosis. Contemporary research categorizes endometriosis and complex dysmenorrhea as involving 4 key mechanisms. Inflammatory. There is chronic systemic inflammation present in the peritoneal environment. Elevated prostaglandins, cytokines, and inflammatory mediators drive both pain and tissue changes. Immune-modulated. The immune system in women with endometriosis is dysregulated. Natural killer cell activity is altered. The body's surveillance mechanism, which would normally identify and clear ectopic tissue, are impaired. Estrogen-sensitive. Endometrial tissue, wherever it's located, responds to estrogen. Estrogen dominance or relative progesterone insufficiency drives lesion growth, pain, and cycle disruption. Neurovascular. There's nerve fiber infiltration into lesions and changes in the neurovascular supply of the pelvic region. This explains why pain can be so disproportionate to the lesion size. The nervous system is involved in a way that amplifies the pain signal. What TCM tells us: the same terrain, different map. Now let's look at the TCM picture. Heat toxins. In TCM, chronic inflammation is understood as the accumulation of heat and toxic pathogenic factors in the blood and tissue. Heat toxins create redness, swelling, and pain. Over time, they damage the integrity of the tissues they inhabit. This maps directly onto the inflammatory picture in modern research. Phlegm nodules, tangible accumulations, cysts, fibroids, lesion deposits, are understood as phlegm, congealed in the presence of qi stagnation and cold. Phlegm nodules are the physical manifestations of a system that has been accumulating rather than clearing. This maps onto the structural changes seen in endometriosis and fibroid development. Blood stasis. Congealed, obstructed blood that cannot move freely creates conditions for both structural changes and heightened pain sensitivities. In the context of neurovascular findings in modern research, blood stasis is a remarkable correlate. Both describe a system where flow is compromised and the tissues become hypersensitized as a result. Chong disharmony. The Chong vessel, the sea of blood, governs the deepest layer of menstrual regulation, reproductive function, and the relationship between the uterus and the broader constitutional vitality of the body. When the Chong is disharmonious, menstruation becomes erratic, painful, and disconnected from rhythmic intelligence that should govern it. This maps onto the hormonal dysregulation, particularly estrogen sensitivity, described in modern research. We do not treat estrogen directly. We treat the kidney and Chong vessel that regulate hormonal cascade. The outcome, balanced hormonal expression, is the same. The pathway is different. We don't treat estrogen. This integrative perspective is not about choosing sides. It's about recognizing that two sophisticated systems of medicine developed across vastly different cultures and time periods have both identified the same fundamental terrain. And when we can hold both maps simultaneously, we are far better equipped to navigate it. I want to close this video and this month's series with something you truly need to hear. Painful periods are not your fault. They're not a weakness, and they're not something you simply have to endure because you were born a woman. They're a communication, a precise pattern, clinically meaningful communication from a body that's trying to tell you something important before the situation deepens further. The question is, are you listening? And do you have a framework for interpreting what you're hearing? That's exactly what TCM offers. Not vague wellness, not general balance, a precise clinical framework for understanding the pattern beneath the pain, and a targeted strategy for shifting it. Pain is not a punishment. It's not random. It's not normal in the sense of acceptable. It's normal in the sense of common, and common is not the same as healthy. Early intervention changes long-term outcomes. The body you build now, the terrain you restore now, is the body that will carry you through conception, pregnancy, and beyond. That work is not separate from your fertility journey. It's the foundation of it. The terrain determines the experience, and the terrain can always be worked with. That is the gift of this medicine. If this series has resonated with you, if you recognize your pain, your pattern, your cycle in what we've been discussing this month, I want to invite you to take the next step and book an initial treatment with me at the Acupuncture Oasis. This is where we sit together, we look at your full picture, identify your pattern, and begin building a strategy that is specific to you. Not a general protocol, not a general plan, a precise, personalized approach built around your terrain. The booking link is in the description below. I would genuinely love to work with you. And if you're not quite ready to book, or if you have questions, or you're not sure where to start, please reach out to me directly. Send me a DM. I read every message, and I want to know where you are in your journey, what you're navigating, and whether I can point you towards the right next step. You don't have to figure this out alone. This is not what this channel's for. This is a community, and I'm here. Until the next video, be curious, be informed, and be vibrant.